Practice standards or practice guideline are those practice that a profession develops and imposes on itself. Practice standards should be based on the best scientific evidence and should ideally strive to surpass minimum requirements established by law or regulation. Although elements of practice standards may be adopted into law or regulation, they are still considered different from law and regulation due to the fact that they are developed by the profession that is engaged in the practice for which the standards are developed. They are voluntarily and they surpass minimums. For example, in the United States, standards for the practice of pharmacy in hospital and health system are developed by the American Society of Health System Pharmacists and are termed best practice. After we will learn the development and the current status of pharmacy practice in hospital, the second part of this unit, I'd like to show you what is the WHO GPP Guidelines. What is the origin of the guidelines? The International Pharmaceutical Federation, FIP, first adopted the guideline for good pharmaceutical practice in 1993. These guidelines were developed as a reference to be used by national pharmaceutical organizations, governments, and international pharmaceutical organizations to set up nationally accepted standards of good pharmacy practice. A revised version of this document was endorsed by WHO in 1997 and subsequently approved by the FIP Council in 1997. In the year 2011, FIP and the WHO adopted an updated version of good pharmacy practice entitled Joint FIP WHO Guidelines on Good Pharmacy Practice, Standards for Quality of Pharmacy Services. In this document, the aim of pharmacy practice is defined as to contribute to health improvement and to help patients with health problems to make the best use of their medicines. By the guideline, the definition of GPP is the practice of pharmacy that responds to the need of people who use the pharmacy service to provide optimal evidence-based care. To support this practice, it is essential that there be an established national framework of quality standards and guidelines. These guidelines are intended to provide a description of ways in which pharmacists can improve access to health care, health promotion, and the use of medicines on behalf of the patient they serve. It is the policy of FIP and WHO to provide guidance to national pharmacy professional organizations regarding the development of their national GPP guidelines. The conditions of practice vary widely from country to country, and each national pharmacy professional organization is best able to decide what can be achieved and within what time scale. What is the mission of pharmacy practice? Pharmacists are specifically educated and trained health professionals who are charged by their national or other appropriate authorities with the management of the distribution of medicines to consumers and to engage in appropriate effort to assure their safety and efficacy use. We know that providing consumers with medication alone is not sufficient to achieve the treatment goal. To address this medication-related need, pharmacists are accepting greater responsibility for their outcome of medicines use and are involving their practice to provide patients with enhanced medicine use services. So the mission of pharmacy practice is to contribute to health improvement and to help patients with health problems to make the best use of their medicines. There are 6 components to the mission. The first is being readily available to patients with or without an appointment. The second mission is identifying and managing or triaging health-related problems. Especially in the community setting, pharmacists should be acknowledged as healthcare professionals whom patients can consult for health-related problems. Because health care product and service are available from the pharmacist, some problems can be managed at this point of care. Problems that require additional diagnostic skill or treatment not available from a pharmacist can be referred to an appropriate healthcare professional or site of care, such as hospital. This should be done in good collaboration between the healthcare providers. The following points are health promotion, assuring effectiveness of medicines, preventing harm from medicine, and making responsible use of limited healthcare resources. To improve the use of medicine, pharmacists have the responsibility for many aspects of the process of medication use. This begins with assuring the integrity of the medicine supply chain, including detecting under-quality medicines, ensure proper storage of medicine, and the quality preparation of medicines if needed. It also includes assuring the proper prescribing of medicines so that dose regimen and dosage form are appropriate. Instructions for use are clear. Drug-drug and drug-food interactions are prevented. Non- and predictable adverse drug reactions, including allergies and other contraindications, are avoided. Unnecessary treatment are minimized and the cost of medicine is considered. Another important component of this mission is assisting patients and those administering medicine to understand the importance of taking medicine properly, including the correct timing of dose, food, or other medicine to avoid when taking a dose, and what to expect about taking the medicine. Monitoring treatment is verified. Effectiveness and adverse drug event is also an important part of the process of use of medicines. Let's move to Role 3, maintain and improve professional performance. There is only one function described here. Plan and implement continuing professional development strategies to improve current and future performance. Pharmacists should perceive continued education as being lifelong and be able to demonstrate evidence of continued education or continued professional development to improve clinical knowledge, skill, and performance. Pharmacists should take steps to update their knowledge and skill about complementary and alternative therapies, such as traditional Chinese medicine, health supplement, acupuncture, homeotherapy, and naturopathy. Pharmacists should take steps to update their knowledge and engage in implement of new technology and automation in pharmacy practice. Pharmacists should take steps to become informed and update their knowledge on changes to information on medical products. The role 4 is contribute to improve effectiveness of healthcare system and public health. There are 4 functions in Role 4. Function A, disseminate evaluated information about medicines and the various aspects of self-care. Pharmacists should ensure that the information provided to patients, other care professionals, and the public is evidence-based, objective, understandable, non-promotional, accurate, and appropriate, and should develop or use educational materials for health management, health promotion, and the disease prevention program that are applicable to a wide range of patient populations, age group, and health literacy levels. Pharmacists should educate patients on how to evaluate and use any forms of healthcare information, and strongly encourage them to be advised by a pharmacist. Pharmacists should assist patients and their care providers to obtain and critically analyze information to meet their individual needs. Function B, engage in preventing care activities and services. Pharmacists should engage in preventing care activities that promote public health and prevent diseases. That is in areas such as smoking cessation, infectious and sexually transmitted diseases. As earlier mentioned in Role 2, Function C, pharmacists should provide point-of-care testing, where applicable, and other health screening activity for patients at higher risk of disease. Function C is comply with national professional obligations, guidelines, and legislations. Pharmacists should take steps to ensure that they comply with the provision of a national code of ethics for pharmacists. Function D is advocate and support the national policies that promote improved health outcomes. Pharmacists should contribute to public and professional groups to promote, evaluate, and improve health in the community. And pharmacists should collaborate with other healthcare professionals in their effort to improve health outcomes. The guidelines always emphasize that minimum national standards should be established for those above-mentioned activities. Specific standards of GPP can be developed only within a national pharmacy professional organization framework. This guidance is recommended as a set of professional goals to be met in the interest of the patient and other key stakeholders in the pharmaceutical sector. Responsibility for moving the project toward will rest with each national pharmacy professional association. Achieving specific standards of GPP for each nation within these recommendations may require considerable time and effort. As health professionals, pharmacists have a duty to begin the process immediately. Let's talk about the requirement of GPP. GPP requires that a pharmacist's first concern in all settings is the welfare of patients. The second is that GPP requires that the core of the pharmacy activity is to help patients making the best use of medicines. Fundamental functions include the supply of medication and other healthcare products of assured quality, the provision of appropriate information and advice to patients, administration of medications when required, and the monitoring of the effect of medication use. GPP requires that an integral part of the pharmacist's contribution is the promotion of rational and economical prescribing as well as dispensing. GPP also requires that the objective of each element of pharmacy services is relevant to the patient, is clearly defined, and is effectively communicated to all those involved. Multidisciplinary collaboration among healthcare professionals is a key factor for successfully improving patient safety. At the national or appropriate level, it is necessary to establish legal workforce and economical frameworks. From the legal framework to define who can practice pharmacy, the scope of pharmacy practice, the integrity of the supply chain, and the quality of medicine. From the workforce framework, one can ensure the competence of pharmacy staff through continued professional development programs. And also, it defines the personal resources needed to provide GPP. The economic framework provides sufficient resources and the incentives that are effectively used to ensure the activity undertaken in GPP. GPP includes standards that often exceed those laid down by national legislation. In fact, legislation seldom gives precise instruction about how the services should be produced to meet the requirement. Therefore, National Pharmacy Professional Association have a role in setting standards required for GPP, which include a quality management framework and a strategic plan for developing services. It is also recognized that in developing national standards for GPP, attention must be paid to both the need of the user of healthcare services and the capacity of national healthcare systems to support these services. Since pharmacy practice will vary among nations, it will also vary among practice locations. Therefore, standards should recognize the uniqueness of different pharmacy practice settings. For example, community and the hospital pharmacy. In addition, as medicine and the need change all the time, the standards should acknowledge evolving practice setting and provide these developing services with guidance without negatively affecting the evolutionary nature of practice. At the same time, a baseline should be established for practice, below which the activity cannot be considered pharmacy practice at all, and therefore should not be condoned. Many of the rules and standards influencing pharmacy practice has been established within the profession by pharmacists, not imposed by external regulation bodies. These rules and standards are followed by pharmacists because the profession agree that they are the best thing for our patient and the public. Health systems certification and the accreditation requirement and the pharmacy guidelines form a basis for setting pharmacy standards. Compliance with accreditation and the certification standards, while voluntary, is essential for an organization. Meeting the minimum requirement of national legal entities is mandatory. Standards established by pharmacy professional organizations are often optimal and may be more challenging than accreditation and the legal requirements. Internal requirements, for example, organization and the department standards, must be consistent with external requirements. Whatever the source and whatever voluntary or mandatory, compliance with this requirement raise the level of pharmacy services and improve the quality of patient care. When establishing minimum standard of GPP, FIP emphasizes the importance of first defining the role played by pharmacists as expected by patient and society. Secondly, relevant functions for which pharmacists have direct responsibility and accountability needed to be determined within each role. Thirdly, minimum national standards should then be established based upon the need to demonstrate competence in a set of activities supporting each function and role. The minimum national standards for each activity are based on the process that need to be relevant and defined appropriately according to the local need of the pharmacy practice environment and the national profession aspirations. All national pharmacy professional associations should also adapt this role and functions in accordance to their own requirements.